This is a character assignment video for CNS 567 Diagnosis and Treatment. My name is Sherry Moore, and the professor is Dr. Andrea Jenkins. Without further ado, let's get going here. And first of all, I apologize for the glare in my glasses. I cannot seem to get it out, so just bear with me. So I chose the movie Identity Thief, and the main character, one of them, is Diana, aka Dawn Budgie. And so she was born in Wisconsin. She was given up as an infant at a police station. She was placed in many foster homes throughout her childhood and teenage years. She doesn't know her real name till the end of the movie. She's probably in her late 30s or early 40s. And she had eventually made her way to Florida, where she owns a home and is involved in some type of drug or identity theft ring. So that's a little background on Diana. Here's a description of the presenting problem. She is a real character, to say the least. She is an experienced thief, probably a shoplifter. She uses stolen cars and identities to fund her shopaholic addiction, to pamper herself, to dress well, eat high on the hog, and entertain herself and others. She steals people's identities. She's maxed out. She also makes credit cards with their identities, and she's maxed out the other main character's credit cards, and she's under arrest for warranty for not showing up to a court hearing. Sorry, she's under warranty for arrest for not showing up to a court hearing. And she's got many relationship conflicts. Actually, she doesn't have any close relationships. In fact, if she's being nice to you, you better watch out, because she's probably manipulating you to get what she wants. To socialize and have friends, she goes to bars and hits on men by ordering drinks that they're ordering and sharing with them. She also buys rounds and rounds of drinks for those who are in the bar and considers them her friends while they cheerlead her on. She's loud, bold, obnoxious. She's disrespectful to bar staff and most anyone who gets in her way. And eventually she gets kicked out of the bar for swinging on the chandeliers and just raising a ruckus. And that's the end of her friendships. She certainly has a problem with, and may also have an addiction to, alcohol, food, and shopping, as well as who knows what else. On several occasions, she tries to run away from Sandy, who is there to capture her and take her home and clear his name. But she's overweight, and so she tires out easily. She's being traced by both a tracer for her credit card fraud and the theft ring for providing them faulty credit cards, and this threatens her life and Sandy's as well. But it does provide great slapstick entertainment. She will stop at nothing. Eventually we learn that this protagonist has a wounded heart, a soft and heroic side, and a bit of a conscience. And she saves Sandy's life on 2 occasions. First, from a deadly snake by beating it and him with a torch from the campfire. And then she carries him unconscious a mile out of the wilderness. And following that, she rolls with it when she gets hit by a car trying to save Sandy's life. So here's the diagnosis of this woman's problem. If she were under the age of 15, she could easily be diagnosed as having conduct disorder, because she clearly shows symptoms of persistent behavior problems with serious violation of the rules, aggression towards people, and the destruction of property, deceitfulness, and theft. Since she's over 18, for the purposes of this assignment, I'm going to assume and think that it's pretty likely that she has enough of these problems since age 18 to go with a diagnosis of antisocial personality disorder. She has a pervasive pattern of disregard for and violation of the rights of others, as indicated by more than 3 of the following: having hurt, mistreated, or stolen from another person. And she also has some histrionic features such as attention-seeking, egocentricity, manipulative tendencies, And some examples from the movie that lead to this diagnosis are as follows. She has complete disregard for right and wrong, as indicated earlier. She repeatedly violates the rights of others through intimidation, dishonesty, and physical force. She steals, again, lies, cheats, cons, and exploits others. And I don't think remorse is even in her vocabulary. Diana uses, like I said, a machine to make a plethora of credit cards that she carries in her purse, and she uses in order to satisfy her every whim. And we already know she stole Sandy's identity, but she also steals his car. And later she steals his boss's identity also. Diana displays unnecessary risk-taking and dangerous behavior with no regard for her safety or the safety of others. When she tells Sandy to hit her tracers, who's captured her, his van with Sandy's car and run it off the road so they can escape, so she can escape. And I think it's fairly safe to say that she's hostile and aggressive and violent and has a lack of empathy and remorse about harming others when she uses duct tape to tape the tracer to the wall of his own wrecked van. There are many examples in this movie. It is not a surprise that she has reoccurring problems with the law and other criminals due to her criminal behavior. She breaks the back windshield of a police car and escapes. And at the end of the movie, she also punches a prison guard and gets tasered for it. Antisocial personality disorder is considered a lifelong disorder. However, some symptoms may decrease with age, and Diana's symptoms seem to lessen as a result of her experience with Sandy. Now, Diana does have some normalcy. Like I said, she's well dressed and well groomed. She has a light heart. She has a great sense of humor. She enjoys music and has a great singing voice. She is tender-hearted towards children, and eventually she does do the right thing, including, like we said, saving Sandy's life on several occasions, and by turning herself in order to save Sandy's job and his family. Sandy and his family become an important support system to her, and they visit her in prison and witness her growth in completing her GED. So here is the treatment plan for Diana. First symptom behavior is aggression and risk-taking. Diana's goal will be that she will learn to value her safety and serenity. Her short-term goals will be to list 3 to 5 risk-taking behaviors and journal about the feelings underlying them. She will identify 3 to 5 dreams or interests and will journal daily for 1 week regarding her thoughts and feelings about these dreams and interests. And she will also journal and practice 3 risk-taking behaviors, practice replacing 3 risk-taking behaviors with 3 safe risks towards her goals and dreams and interests. She will complete these within the first month of treatment. As a therapist, I would provide journal and journal instruction. I would encourage her to share her thoughts and feelings around her risk-taking behavior and her goals and dreams and interests in therapy, and provide her poster and magazines for her to create as a vision board for things that she can work towards. Symptom behavior 2, empathy and lack of remorse. The long-term goal for Diana will be to increasingly show empathy for herself and others. The short-term goal will be for her to identify 2 or more challenging childhood situations and the feelings around these, and also show empathy for herself as a child and adult. So interventions would be to provide psychoeducation regarding identification of emotions and the effects of trauma, encourage Diana to bring in childhood pictures and or a stuffed animal that represents her inner child, listen to Diana tell her story, and support her in identifying emotions, especially those in situations as a child. model empathy for her experiences, and encourage her to practice empathy by using positive affirmations. The third symptom behavior would be compulsive, risky, and/or addictive behaviors such as drinking, spending sprees, and sex with strangers. The long-term goal will be for Diana to develop a support system, gain sobriety, and increased stability. The short-term goals will be that Diana will attend 3 to 5 Alcoholics Anonymous meetings per week and get the signature of the meeting chair. She could instead choose Overeaters Anonymous, so either one of those or both. She will be encouraged to get and meet with a sponsor and other members 3 times a week to start developing a family of choice. And then also to release anger and regression. So some interventions for that will be, the therapist would provide her a website, literature, and list of meetings for AA or OA in the area. And then along with other interventions to use expressive therapies and Gestalt therapies techniques to release anger and aggression. I forgot to mention at the beginning of the treatment plan that the theoretical orientation would be person-centered and family systems. Thank you for listening to my video about my character assessment.